understand why you have to eat healthy. They say you are what you eat. Now, World Stroke Organization says stroke claims one life every 6 seconds. In Nigeria, the prevalence is 1.14 per 1,000. What is stroke? I'm here with Dr. Dili Aino, who's a resident and neurologist in training, University of Benin Teaching Hospital. Thank you for joining me on the show.
Good afternoon. Thanks for having me.
Yes, you're welcome. Stroke. And statistics show that it kills more people than tuberculosis, malaria, AIDS put together. That must be serious. So what is stroke?
Yeah, it is. Thank you very much once again. Stroke, actually, if we go by the historical perspective, we can date it back to the time of Hippocrates, okay, and at that time it was said to be a disease of sudden paralysis, okay, sudden paralysis. The person is doing something probably and then suddenly loses function of one part of his body, okay, and then in Greek mythology, okay, it was said to be a disease of sudden violence, okay. So it is something that is sudden.
It just happens.
It just happens. Some people may have premonition, some may not have. It just happens all of a sudden. And to define it in a way that all of us can relate with, okay, I would say it's a disease of the brain, okay, that is sudden in onset, like I said, and is due to, the symptoms are referable to the brain too, and it's due to abnormalities in the blood vessels, okay, that supply or that transport blood to the brain, or that transport blood within the substance of the brain itself. Okay, so the blood vessels are like pipes that carry blood, okay, into the brain and then within the brain. So if that happens, okay, of a sudden onset, we can find out that this is a vascular problem. That means that the problem is from the blood vessels supplying the brain. Okay. Then we can say this is stroke, because there are some other things that will cause sudden paralysis like that, and they are not stroke. They are not from the blood vessels. Okay. And why do we say? How does it happen that the blood vessels contribute to this?
Yes.
You see. The brain, every part of our body anyway needs nutrients and oxygen, and the brain is what we call an obligate aerobe. Okay, it depends on oxygen compulsorily. It cannot do without oxygen. Okay, it needs nutrients too. Okay, so there are some type of stroke. Okay, that the problem with the blood vessels is a blockage, a sudden block, okay, to the blood vessels, such that the parts that are further away from that blood vessels, the part of the brain that are further away from that blood vessels, don't get oxygen, don't get nutrients, okay? So that's, in some part of the world, they call that dry stroke, meaning that blood is not even getting there at all, okay? There are some types of stroke. So that type of stroke, we call it ischemic stroke.
So there are different types of stroke.
Different types, okay? So the other type, the blood vessel, okay, maybe a blood vessel supplying one part of the brain, just all of a sudden starts leaking. So it starts leaking blood into the substance of the brain. In some part of the world, they call that wet stroke. Okay.
So the name of the stroke is derived from the way it manifests.
Or the disease pathology itself, the disease, what happens to that blood vessel itself, whether a blockage or a bleed.
Okay. Yes. Now, before there will be a blockage or a bleed, what will cause that?
Okay. For stroke, there are different causes, okay? And like I said, ischemic, a block, hemorrhagic, a bleed. We say some factors are modifiable, meaning that we can do some things about it. We say some factors are non-modifiable, we can't do anything about it, okay? So non-modifiable factors, things that we don't have control over, a person that has stroke will not have control over. He wouldn't have been able to do anything about it. Okay, we say things like your age. Okay, so the more you age, the more you advance in age, the more likely you are going to have a disease of your blood vessel. Okay, because the blood vessels could thicken, they could become fragile, they could bleed easily.
Due to age.
Due to age, okay. Then we say race, okay? We say blacks predominantly, majorly, okay? We are more prone to having maybe the worst types, okay?
Really?
Yes.
Why is that?
Well, it is likely due to some genes that we have because of our race, okay? Stroke, people have tried to study why some set of people have stroke and some don't, okay? But they've not been able to find out a particular gene, but there are some set of genes that have been implicated, which we do have, which we know that if you have it, it could cause you to have some disease of your blood vessels. And then we say gender. Gender, if you take a man and a woman of the same age, before the woman is gets to the age of menopause, the man is more prone to having stroke than the woman.
Than the woman?
Yes. Then after menopause, the ratio equalizes, sort of. Okay, and then we say family history, somebody that has someone in his family that had stroke. Okay, so he could have inherited some genes that he didn't know about, and then he will have stroke subsequently. Or somebody that has previous history of stroke, he has stroke before, is likely going to have another one.
Oh, so it's possible to have stroke, recover, and then have stroke again?
Yes, because the factors that cause that previous stroke is still present, okay? So those are the non-modifiable factors, and each of these could manifest as either a block or a bleed, okay? And then the modifiable things that we can do something about, and which we emphasize as doctors, the first and foremost will be high blood pressure. Okay, and high blood pressure again can present with a block, can present with a bleed, okay, because it causes some changes in the blood vessels that can make it to thicken, sort of, and then blood doesn't flow freely through it, and then as time goes on, blood starts staying too much in a space, and then clots and blocks the blood vessel. If the BP is too high, okay, it can just tear apart the blood vessel
and then cause the
bleed. Okay. Another one is blood sugar, high blood sugar. Yes, which also we know to cause a disease, okay, in the blood vessels, not only in the brain, also in the heart, in the kidneys, in the eyes, some other parts of the body. Another one is high cholesterol, okay, which is also, you can relate it to diabetes or hypertension. Another one is obesity. People that are very obese, they have a gamut of problems that could lead them to having disease of the blood vessels. Other things like smoking, very, very important.
Lifestyle.
Yes, lifestyle. Alcohol, people that drink alcohol excessively. Also some other things, drugs that make your blood to clot abnormally, inherited diseases that make your blood to clot abnormally, people that take hard drugs like cocaine, heroin, that can also affect the blood vessels, and this usually make people to have a block in their blood vessel usually.
I was really surprised to know that children could also have stroke, because according to the World Stroke Organization, it also mentions children as people who could have stroke, so it means anyone can have stroke. I'm particularly interested in that of children. How can a child have stroke?
Okay, we say there's what we call stroke in the young. Okay, like I said, advancing age is a risk factor for having stroke, but people that are very much younger can also develop stroke. Usually, those are people that have a primary problem with the blood vessel. Primary meaning that it wasn't because they had hypertension, it wasn't because they had diabetes, it wasn't because they did anything. It's just, so we call something like vasculitis, something that makes the inside of the blood vessels to get inflamed, and if that happens, of course, blood will not flow freely through it, and then you can have some clots, also very important is a disease like sickle cell disease. Yes, it causes the blood vessel, the red blood cells, that carry oxygen to sickle, to form an abnormal shape, and then can just go and block the blood vessel. Some other inherited diseases that make the blood vessels to clot, which the names are very they are more technical.
You confuse the person watching.
Yes, but we know that there are some diseases that make the blood vessel, the blood inside blood vessels to clot abnormally.
So it can happen in a child and then results in stroke.
Yes. And some other diseases, also diseases of the heart. People that have abnormal contractility, contraction of the heart. The heart is meant to contract as a unit like this, For some people, their heart contracts very irregularly.
Okay.
Okay. Some people have a very big heart, and a big heart is a heart that would allow blood to stay for too long, and clots will start forming. If you drop blood on the surface, for example, for too long, it will clot.
It begins to clot.
Yes, the same thing can happen in a heart that is not contracting normally, or that is too big.
Okay.
And then the person can throw that clot into the brain.
Now, while you were talking, you said stroke is something that happens suddenly. Some persons may have premonition that they're about to have stroke, some may not, and just while on one activity this happens. What are the signs and symptoms of stroke? How would you know a person has had stroke?
Okay. Stroke. Let's liken it to an apartment, okay, where you have pipes that supply water. Okay. You have the kitchen, you have the toilet, you have the bedroom, you have different parts of the house. Okay. So if you have a problem with the pipe supplying water to the kitchen, you have problem with cooking, for example.
Yes.
Bedroom, you cannot take your bath, and so on and so forth. So stroke, essentially, the brain is like a house, and there are different parts of the brain. Okay, there are some parts of the brain that control the way we move our limbs, our muscular activity. There are some parts that control how we feel touch, sensation, and some other sensory modalities like that. There are some parts that control the way I'm talking, the way we hear and understand, the way we see. So depending on the parts of the brain where this block or bleed occurs, then you have a symptom referable to that part of the brain.
Okay.
So you could have that a person all of a sudden just notices that the mouth is deviating to one side of just one side, okay, or the face just droops. Okay. You could have that the person is just doing his normal thing, and then all of a sudden could not lift his hand or one part of his, one part of his hand or his leg. Okay. You could have that the person could not just feel all of a sudden, could not feel anything again. Okay. The person could be talking, and then the talk just twists, and then it's not clear again. The person all of a sudden could just see like something just drops like a curtain on his visual field, and he just doesn't see. A temporal blindness kind of, okay? So these different manifestations occur, and for you to know, okay, that this is stroke usually is a suspicion, okay, based on the suddenness of the symptom. If a person has a bleed, usually a person could start complaining of headache, a sudden onset headache, headache, okay, and before you know it, because it's a bleed, the blood vessels continues to bleed. You are going to occupy the inside of the skull, and it's going to compress on the brain. Okay, so the person vomits. Before you know it, the person could start losing consciousness. Okay, before you know it, the person could just like pass out. Okay, so those are some of the things that could happen. Okay, with stroke. Of course, stroke will come with convulsions like seizures. Okay. Also a problem with passing urine, feces, and some other things like that. But the suddenness of a symptom referable to the brain, how sudden it is, will alert a person to know, oh, this most likely will be a stroke. Okay, and then you address it accordingly.
Okay. Now, for someone who suffered stroke, or you have someone in the house who suffered stroke, is there something like first aid that can be done instantly before the person is being rushed to the hospital?
Okay, thank you. You see, stroke, like you said, you talked about the magnitude of this problem. Because of the magnitude of this problem, and because of how potentially dangerous it is, everybody has to know one or two things about it. Like you said, 60 million people worldwide live with stroke. It kills one person in 6 seconds, 6 people in 1 minute, 6 million deaths per year. Is a very, 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 very big problem. And so what we usually tell people is to act fast. Fast meaning F-A-S-T. Okay. So you are in a house, or you're at work, or you're anywhere, or you yourself, you just notice the symptoms yourself. F stands for face, okay? Facial weakness, okay? It just sees the face just deviates or droops, okay? A stands for arm or leg weakness, okay? Then S stands for speech. Okay, the person all of a sudden is talking, he twists, or doesn't understand you again, doesn't understand speech, or cannot make appropriate speech. So when that happens, the best thing to do is to start running to the hospital. Usually, there are no first aid that you can do at home for stroke, except to quickly bring the person to the hospital, because the earlier you bring the person, the more salvageable
it is.
it is. Usually we see people brought to the hospital, more than 80% of them, after 24 hours of the stroke, and you can't do anything about it. And we say time is brain, neuron, time is neuron. If you delay, now we have like 200 billion neurons in our brain, okay,
really?
that control all of the activities of our body, the way we move and everything.
Okay.
Now, if somebody has stroke, every minute he loses, before you look here and there, irreversible damage has occurred. So we usually say, you treat stroke, you attend to stroke the same way you attend to trauma. Like somebody has a road traffic accident, breaks his bone, starts bleeding. You know, the way you rush to the hospital, the same way. Somebody has a heart attack and says, hey, pain in my chest, the same way you run to the hospital, please do when you see or recognize stroke. So we say recognize stroke. Okay, we say react. So your reaction should be to maybe find an ambulance or something, something to transport you very urgently to the hospital. Then respond, the person in the hospital responds to you on time. Then we say review. The person would usually say you should go and do a test. We call a CT scan, just to review whether it's a bleed or a clot. Okay, and then you start treatment and you rehabilitate. So usually there's nothing much you can do at home except to prevent it from occurring. Once it has occurred, you have to run to the hospital. Okay,
now we'll get to the hospital. And what happens? How can a person who has suffered stroke be treated?
Okay. Again,
is it even something that one can recover from fully?
Yes, it is possible to recover from stroke fully. It depends on the magnitude of the damage that has occurred, the type of stroke it is, and possibly the person's previous history. For example, somebody that has stroke before in one part of the brain, has another one in this other part of the brain, the damage may not be very nice. So because we say time is brain, within 10 minutes, if you can get to the hospital, ideal. Then a stroke specialist sees the person within 15 minutes. That's the ideal thing. You do these imaging tests to check whether it's a bleed or a clot. Within 25 minutes, that's the ideal. Then within 45 minutes, that imaging test gets reported by a specialist. Then within 60 minutes, you've started treatment. That is the ideal.
Let's say, give and take, 1 hour, ideally, the person should receive treatment.
Exactly. So anything more than around 4 hours is bad, because the brain cells that are affected have died and they won't come back again.
So they don't regenerate.
They don't regenerate. So we try to salvage the surrounding parts so that those ones too don't, get to die. So usually what we do is to start treatment, which I think is beyond the scope of this discussion. Okay, but definitely if we start early and we start rehabilitating the person early, treat what is causing the stroke, there are some things that we can do to quickly reverse the stroke itself. If it presents early, before 3.5 hours, 4 hours thereabout. So if those things are done, the damage may be reversible, or we could salvage the brain.
Okay, the number to call will scroll on the screen. You can call Dr. Daly Aina and ask him a question as it concerns stroke. Now, let's talk about rehabilitation. How well is Nigeria doing in the area of rehabilitation? What does rehabilitation of a stroke patient even means?
Okay, when we say rehabilitation, we mean that we want to start engaging the part of the body that the stroke has affected. The arm is weak. Now we want to start engaging the arm as if it wasn't damaged by the brain. So that, because we do know that if we start early like that, the brain has a way of readjusting itself to know that this person still needs his arm. This person still needs his leg. Okay, so we call something physiotherapy. We start that very early, and then the brain will rewire itself to start to respond to this stimulus. Also, the person that has stroke, he was a banker before, maybe he was a journalist, you know. So we want to do occupational therapy. Okay. So readjust the person to his previous occupation. So speech therapy. Okay. So there are various modalities like that. Just to
it depends on the part that is affected.
Yes, to reprogram the person back to his functionality.
Okay. Now in rehabilitation, how well is orthodox method doing in rehabilitating a person who has suffered from stroke? Because sometimes what we say is that someone who suffered from stroke after going to the hospital, visiting a physiotherapist and all, sometimes they still fall back to try the medical homes.
Well, that's a big problem for us in this country. And it's unfortunate. We don't have much of
okay, we have a caller on the line. Hello? Hello? Hello, good afternoon. What's your name and where are you calling from? Okay, go ahead, ask your question. Hello?
Hello, I can hear you.
Okay, go ahead.
I'm calling from Fiji and
okay.
So my question to doctor is, what is the cause? I was wondering when people started concussion.
Okay, cause of stroke.
So actually, what causes stroke?
Okay.
What is the cause?
Okay.
Because I have a patient around.
You have a patient around?
Yes.
Okay.
I have a patient around, my own senior sister.
Okay. Okay.
Very long time. So I don't actually know what is the cause. Some people told me that it's as a result of stress and overworking and not resting.
Okay.
Thank you.
Okay. He says he has a patient who suffered from stroke that some persons told him it's as a result of overworking and not resting. He wants to know the cause. So can we quickly recap?
Okay.
Or do we take the call first?
Okay, maybe.
Okay. Let's take this call. Hello? 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 We lost the call. So what causes stroke?
Okay.
He said he didn't listen at the beginning.
Now, what causes stroke? Like I said initially, we say some of them are things that we could modify, we could control. Some of them we cannot control.
Okay.
We can't control a person that has people in his family that has stroke. The age, I said, gender, like I said, race, we can't control that. Person that had stroke before, we cannot go and control what that stroke, the initial stroke, okay, that has happened already.
Hello, we have another call. Hello. Hello, good afternoon. This is Healthy Living. What's your name and where are you calling from? Please turn down the volume on your TV set. Turn it down, please. Hello? Hello? Okay, we lost that call.
So then again, like I said, high blood pressure, hypertension, high blood glucose or sugar, okay, diabetes, high cholesterol, being overweight or obese, smoking, alcohol.
Okay, we have another call. Hello. Good afternoon. What's your name and where are you calling from?
I'm calling from, my name is Emmanuel.
Okay, ask a question. Doctor's listening.
My father has a stroke 2 years now.
Okay.
But he's still strongly with the stroke. So we have been giving him a native medicine, but no improvement.
Okay.
Please, can native medicine or English medicine, which one can we use for him? For almost 3 years now, he's done.
Okay. Doctor will respond to that.
Please, I just want to know which medicine can we use for him.
Okay. Okay.
Thank you.
Okay. This second caller takes us back to our question. People using medical help.
Okay. Can I complete the first question?
Yes, let's complete the first one.
Okay. So to respond to that person's question or curiosity, stress or being overworked,
okay,
doesn't directly lead to stroke.
Okay.
If you're overworked or stressed, what you need to do is to check your blood pressure, check your sugar, check your weight.
Okay.
Then if you don't have any other things that could lead to stroke, maybe your family and things I've mentioned before, you don't smoke, you don't drink alcohol, we don't know from our medical knowledge that stress leads to stroke. We don't.
So maybe there are other conditions
there are other
unknown
conditions
to
unknown
him.
to him. Most people don't know they are hypertensive. Most people don't know they have diabetes. Most people don't check their weight against their height to know if they're obese. So some of these things happen and they come down with stroke. Okay,
to the second question, using tradimedical help.
Okay.
Can it help someone who suffered from stroke? He said the father has been down for over 2 years. They've used native medicine according to him.
Okay. Well, we know truly that there are some reported traditional medicines that have been tried on stroke. Some said they work, some maybe not so clear to us. But you see, when we treat as physicians, we treat based on evidence. Most of these traditional medicines, they are not evidence-based. Okay. They are not things that a physician, from his knowledge, should do. Okay. So now acupuncture is there. Some people give ginseng. Some people give jingo. Some people do what we call cupping. There are different methods, but we don't have enough evidence to say, okay, this is what is therapeutic for you. Go and use it.
Okay, so it cannot be proven.
We can't prove it. Although there are reported cases of some of them working for people that have had stroke. So, to the best of my knowledge, we don't encourage that yet.
Okay. That question is in two parts. He wants to know if orthodox medicine can treat someone with stroke. But let's take this call first. Hello? Hello? Please turn down the volume on your TV set. Turn it down. The volume on your television set. Turn it down, please. Hello? Hello? Can you turn down the volume? It's too loud. Your TV is too loud. Okay, we can't take that call. Please, when you call, turn down the volume on your television set and listen from your phone. That way, it will help us and help you. So, doctor, hello? Okay, we lost that call. I said that question is in two parts. He asked if he can use traditional medicine, and he also asked if orthodox medicine can treat someone with stroke.
Like I said, I would not recommend that.
Okay.
I don't have so much knowledge in traditional medicines. So what we do know, when we treat, we say there are some class of evidence, there are levels of evidence. What physicians do are things that are universally acceptable. If you do it here, it is reproducible in the United States, in the United Kingdom, in Germany, anywhere. These are well-established facts.
Okay, so in this case, what can he do to help the father?
He should come to the hospital.
He should take the father
Although
to the
stroke
hospital
has occurred already, but of course we can do some post-stroke rehabilitation, post-stroke, in fact, we call something secondary prevention of stroke. Somebody that has stroke, we want to do things to prevent him from having another stroke. Because like I said, previous stroke is a risk factor for having another stroke, so we don't want that to happen. So if you just come to the hospital and then we assess and treat appropriately.
Okay. Now, how do we prevent stroke? For someone who's had stroke before, for someone who's never had stroke before. Hello? We'll have a caller on the line. Hello? Hello, good afternoon. This is Healthy Living. What's your name? Or hello? Hello, I can hear you. What's your name and where are you calling from?
I am Mr. James. Calling from
your TV is too loud. The volume on your TV is too loud. Can you turn it down a little?
Okay, that's all right.
Okay.
Is that clear?
Yes, it's okay. Now go ahead.
Okay. Please, I want to ask the doctor. He has been talking about curative medicine after it has happened. Is there no anti-drugs for against strokes? Because there are other anti-malaria drugs, diabetic drugs, and all that. So he has not mentioned any drugs that one can take in terms of preventing these things not to happen. Because they say prevention is better than cure. So the doctor should advise us on what kind of drugs that is available, or if there's nothing available at all.
Okay.
Thank you.
Okay. Is there something like a vaccine or anything one can take to prevent stroke?
Okay. Unfortunately, we don't have anything like a panacea to just prevent somebody from having stroke completely. So what we address is to address the things that can cause stroke. So we say those are primary preventive measures, meaning that you've not had stroke, but check your blood pressure, check your blood sugar, check your weight, check your cholesterol. Are you smoking? Are you drinking? Are you on drugs that can make your blood to clot abnormally? Hard drugs. So those things. So we check those things, okay, and then ensure that they are not there. If you have high blood pressure or hypertension, take your drugs. If you take your drugs and your blood pressure, you reduce your blood pressure. In fact, we know from scientific knowledge, if you decrease blood pressure by about 10 millimeters of mercury, your risk of having stroke decreases by about 25%.
Okay.
So you decrease, so if you reduce your blood pressure alone, you can be sure that most likely you are not going to have
okay,
stroke.
so the prevention of stroke is the
Yes.
prevention of the risk factors
that lead to stroke.
that lead to stroke.
Yes. If you have blood sugar, high blood sugar, control it. We use medications, diet, exercise. If your blood sugar doesn't rise to the values that can predispose to having stroke,
Okay.
then you may not have stroke most likely. Cholesterol. So those are the things that we encourage. You are smoking, please stop smoking.
Okay.
You drink alcohol. Well,
Okay, let's do a call. Hello? Hello? Hello, go ahead, I can hear you. Okay, we lost that call. All right, now doctor still talking about stroke. Now, for children, going back to children now, children who suffered stroke, is it easy for them to recover compared to adults?
well, for children, the cause of stroke will determine how reversible or
Okay.
not reversible it is.
Okay.
For people that have sickle cell disease, for example, we know it's a permanent problem with their red blood cells, and except that is...
We have a call. Hello?
Hello.
Hello, go ahead. Hello? Hello, are you there? All right, doctor.
So except that is addressed, okay,
Your TV is too loud. The volume on your TV is too loud. Turn it down. Hello?
Hello. Hello.
Hello, go ahead.
Are you hearing me?
I can hear you.
Okay. Somebody that has stroke, that they don't have BP.
Supposing you have stroke and you don't have what?
BP.
Okay,
Temperature is normal,
high blood
because
pressure.
everything is normal. But then you see a partial stroke, they are according to it.
Okay. Supposing someone doesn't have high blood pressure and the person has stroke.
other factors, like I said, diabetes, cholesterol, smoking, alcohol, things that cause your blood to thicken. They are also causes of stroke.
Okay.
But we do know that in some cases, we do all the tests, we cannot find a cause for this
Okay.
stroke. So it is possible that stroke does not have a cause for this particular person.
Okay.
Also, there are some people that they don't have any problem at all, but because of aging, their blood vessels just become very fragile, and then some things deposit there. You know, there's a name that we call that, and
Okay.
then it makes their blood vessels to just bleed, to just tear apart and bleed.
Okay.
So we know that does happen. Okay, so it is possible, yes, that somebody doesn't have high blood pressure, is otherwise normal, but then has stroke.
Okay. Now, in your practice, what age group have you found to come up with stroke cases more? What age group do you find the prevalence of stroke in Nigeria?
From my own experience, I would say that they're usually between 40 and 70, thereabout.
40 and 70,
Yes,
okay.
yes. So, of course, we expect it to be more in people that are elderly.
Okay.
But because here, most of us, we lack good health-seeking behavior.
Okay.
Okay, we don't check our blood pressure, we don't know if we are diabetes, we don't check our weight, we eat anything we see.
Okay.
So somebody that is a bit younger could have had a very, very elevated blood pressure and then will come down with stroke. Okay, somebody could just be big and then is not metabolizing his sugar very well. He has
Okay.
diabetes and he doesn't know. Okay, so that makes us to have a stroke a bit earlier. Okay, so like I said, usually 4th decade, 5th, 6th, you know, you get to see them.
What about gender? Do you find them more common in men or in women?
Well, I've not done that statistics personally,
Okay.
but once you pass the age of menopause, from my experience,
Okay.
The discriminant between the genders doesn't appear to occur again. So you get to see them almost in an equal ratio,
Okay.
usually.
Okay.
But younger than that, you tend to see men
Okay,
more.
okay.
Yes.
All right, as a wrap up, what's your advice to people out there about stroke?
My advice is that we should understand how stroke presents,
Okay.
and like I said, act fast.
Okay.
Know that facial weakness, arm or leg weakness,
Okay.
speech abnormality, all of a sudden onset, please act fast.
Okay.
Time is brain. That is number one. And number two is to engage in in prevention of stroke.
Okay.
Primary prevention for it he hasn't had stroke before. Please, at least once a year, we should have our blood pressure checked, sugar, cholesterol, do an annual check at least. Like I tell people, that just the same way you know a bit about your car, you should know a bit about your health.
Okay.
It is a responsibility to live healthy. So you have to know something about it. Okay. So engage in regular checks at least once a year. Okay, so that you know your health status. Okay, so you can prevent it. And then if you are diabetic or hypertensive or you have any of these other risk factors, please seek a physician. Let them get you treated for this, and let those things be put under control. If you have had stroke before, of course, definitely you have to see a physician in stroke that has expertise in that. And of course, there are some things that will give you to prevent you from having a recurrence of stroke.
Okay. Thank you so much, Dr. Dele Aina, for coming to the show today. That's Healthy Living for today. You've heard it all about stroke. There are things that you should do, and one of them is always watch your health. Be the first person to watch your health. Don't wait for things to happen suddenly to you. Once in a while, go to the hospital and just have a proper check done. And for those who maybe have a family member or loved one who suffers stroke and do the trial here and there, you try the medical ways, you try the orthodox medicine, and you mix them together and you're not getting the results. Well, doctor says that they believe in what is proven. And I think also that it should be one way. Just stick to one. And Healthy Living would advise that you go to the hospital if you know someone or if you have suffered a stroke. My name is Blessing A.J. I'm going to say thank you again to Dr. Dele Aina for being a part of the show today.
You're welcome.
Have yourself a wonderful day.